Good morning, Lucinda. I received your intake from our front desk, and it looks like you're experiencing some anxiety, and so I want to hear a little bit from you what that looks like.
Well, I've been getting a series of anxiety attacks. They sort of just started a few months back where I didn't even think it was anxiety. And at first it was just me feeling a little off, a little dizzy every now and then. But as of recently, as school has kind of gotten heavier, it just seems that it's gotten worse, this anxiety of just needing to get these perfect grades for this program I'm trying to get into. And it's just I can't go anywhere. I start to feel this disorientation and my chest starts to feel really tight. I feel like I can't focus. If I was with you outside, even just right now, I feel a little anxious talking to you. But it's hard for me to make eye contact with people. It makes you feel nervous, and I feel like I'm scattered. Even right now, I feel like I'm kind of talking in this scattered manner because that's what the anxiety has done to me. Mm-hmm. It's where I can't focus on it just because I'm focusing on my anxiety so much.
Okay. So it sounds like you've been experiencing this for a few months now. You said it's been several months, and it sounds like you're having a lot of physical symptoms that are being presented from this anxiety that you're experiencing. Is that correct?
Yeah, and it makes it really difficult to go anywhere. It just seems like I used to be able to do all these things, go out of town and go to these concerts, and the other day I actually went to a concert and I had a huge panic attack being at the front of the stage. I felt really claustrophobic and I felt like I couldn't breathe. I had to get out. It's just been feeling like anywhere I go, I can't be by myself, and it makes me feel just terrible because I don't feel like myself anymore. I can go and do anything by myself anymore. I have to be with someone. I have to be with my boyfriend or a trusting friend.
To be able to feel a little less anxious.
Yeah.
Okay. So that it sounds like perhaps school and the pressures of your courses have perhaps made your anxiety increase some. That's what I'm hearing from you, and now you're unable to go to these events that you were able to go to before with on your own. Now you're feeling maybe a little dependent on your significant other or friends to be able to do these things that were at one point pleasurable to you.
Yeah, and yeah, that's actually right. I feel super codependent on having to be with somebody, and it just sort of sucks because I have to work on somebody else's time, when they can go, in order to accommodate their schedule, because I can't go and do it by myself anymore.
I see. So that's also affecting you, the fact that you can't do things on your time. You're feeling like you have to wait to see if this other person is available for you to be able to attend these events that you would like to attend. Can you tell me of a time where perhaps you weren't feeling this way in the past? Before, was it prior to the three, you say several months that you've been feeling this way? Was there a time that you did not feel this way?
Yeah.
And what did that look like for you?
It was actually before I started doing everything for the nursing program, but when I realized that the nursing program was just so rigorous to get into, everything had to be perfect, just straight A's across the board. I just started feeling this tremendous pressure that I needed to do everything perfectly. Everything was being judged to the T, and if I didn't get it done right, then I wasn't going to get into this program, and then I wouldn't become a nurse, and then I would just be waiting for years to get into this program, and I didn't have that before. Before I just felt like I could get into a major and then just transfer, and that's not the case anymore. These programs are really competitive, and I just don't feel like I might be good enough.
it sounds like your academics is like really just the anxiety that you're experiencing with your academics is kind of going into your social life as well, and it's affecting that as well. Would you say that your academic anxiety is better than the social anxiety you're feeling, or?
No, I feel anxious in the classroom, and I feel anxious when I'm with friends, even with my family. If I go to a family event, I feel anxious there. I feel like I have to hurry up and get back home to get to my assignments, and I can't enjoy anything anymore.
So across the board, your anxiety is really affecting both areas or all areas of your life.
Yeah.
Okay. So I'm gonna give you we're gonna look at this grounding exercise here. These are some techniques that you can use between the time that before our next session, because we're gonna see each other again next week. But I didn't want to leave you without having something that you can use when you are feeling these physical symptoms of anxiety. And so the first one here would be the 4-5-3-2-1 technique, where you are basically using your senses. You can use your sense of sight, just looking at small details and patterns on the ceiling, wherever it is that you're at. If you want to, count things on the wall or on the ceiling, on the floor, to help distract you from those thoughts of anxiety, or those thoughts that are creating the anxiety. You can also use your sense of touch, perhaps carrying maybe some type of a token that you can hold in your hand and touch, and just think about the sensations that you're feeling there. Help again distract you from those feelings of anxiety, or those feelings that are causing you to have anxiety. And you could also use your sense of smell. If you have perhaps a lotion or some sort that has maybe like a lavender scent or some scent that would make you feel at peace,
Sure.
calm. You can do that as well. So these are just some exercises or techniques that you can use before we see one another again for our next session. Okay, and I hope that they help you out. In the meantime, journaling as well. If you would like to do some journaling, then we could kind of go back and talk about what those thoughts or those whatever it is that you journaled looks like. Okay.
Do you happen to have a printout of this?
I do, and I can get that